Any FGM in the UK is illegal, but if it's carried out on either a UK national, a permanent resident, or someone who's habitually resident in the UK abroad, then that's now going to be a crime, that third category. Does that make sense? Hopefully that's kind of a potted version of the Serious Crime Bill and FGM.
Anonymity as well.
Yes, that's right, they're protection orders, so protecting the anonymity of those who report the FGM, because that's a really important point, thank you. I wrote that in my notes, and that's a really crucial point. The reason being that obviously this is an act that is supported by the community, and it's very sort of dear to the community, if we're honest. And so if a girl or a woman steps up and says, actually, I'm against it, I'm not going to have it, you can think about the ramifications. She may be ostracized from the community. There may be socio-economic ramifications. She's no longer marriageable. She needs to find somewhere to live. She may be the victim of abuse or threats. So that needs to be borne in mind. You know, we want to safeguard, and the safeguarding continues, you know, not just after that disclosure, not after just taking the immediate actions. That girl or woman also may need to be protected in that situation. Right, so just looking at some of the risk factors, we've spoken a lot about the community and country of origin. The position of the family and their level of integration into UK society, the more westernised people get, the more knowledge perhaps they have about, you know, what the complications are, what it may lead to, and decide that they may not want to have it. That may empower the woman or girl. So that's an important aspect. The mother and or sister have undergone FGM, so, you know, first-degree relatives, if they've undergone FGM, the risk is heightened. Withdrawal from personal, social and health education, or personal and social education, including from learning about FGM. So if in a school there's an element of education about FGM and the family have withdrawn that child from that education, then that needs to be viewed perhaps as a risk factor. What about immediate risk of FGM? A planned visit home to see the family, so you may hear girls talking about, I've got this trip coming up, I'm going away. Often it takes place, you know, in the summer holidays, because then there's enough time to travel and recover from the procedure. Mention of a special ceremony to mark her entry into womanhood. There may be an older relative visiting the UK, truancy, or she may approach one of you with a plea for help. I just want to say about the visit home, because I've been doing some work with a travel clinic about FGM, and there is a phenomenon. People are not stupid, they know what the legislation is. Then they may not say to you, I'm going to Sierra Leone, I'm going to Egypt, you know, they may actually say, I'm going to Europe, and then their plan may be to go from Europe or from another location. I also understand that in Dubai, for example, there is a cutter. So it's not necessarily the geographical expectations that you have. What are the indicators that the FGM may have occurred? So a girl or woman may appear in obvious discomfort. She may come into the classroom, be unable to sit down, literally because she's in so much pain. So difficulty walking, sitting, standing. She may be spending long periods in the toilets because of problems passing urine or problems with her periods. She may spend long periods away with bladder or menstrual problems. You can ask any questions along the way if you want to. A lot of information. I've broken. I'll keep talking. So a girl or woman may have frequent urinary, menstrual or stomach problems. She may have prolonged or repeated absences from school or college. She may be particularly reluctant to undergo normal medical examinations, and that's really important also, not just in the education setting, obviously in the health setting. She may not come for her smears, she may not come for antenatal appointments, she may be frightened of being examined. It may only be at the time that she has to give birth that suddenly it's discovered, that she's actually undergone FGM. She may confide in a professional, she may ask for help but not necessarily disclose all the information, so the same as all forms of safeguarding, just give you a hint that something's wrong, and it's you know, our sort of knowledge and skills which will help us to sensitively extract that information from that child to ensure that she's properly safeguarded, or that woman. She may describe pain or discomfort between the legs. There is a risk assessment tool. You've got the reference to it at the end of this handout that the Department of Health have issued. I've helped work on that. It's very long, but it is worth having a look at, and it talks about, you know, obviously we're not going to have an approach of taking a child away from their family for 18 years until they're no longer at risk of FGM. That's just not going to happen. So review, assessment may well be an ongoing process, and I think that waits to be clarified how that process and review is going to take place and at what intervals. But the 4 C's that I kind of put together of how to make an initial risk assessment of, is there some kind of risk of FGM? Do you come from a community that practices cutting? And remember, that may not be automatically obvious. As I said before, it may be that, blonde-haired, blue-eyed Scandinavian woman sat in front of you whose partner is, say, from Somalia. She may have had FGM, and she may be planning to have her children have FGM. Have you or any member of your family been cut? Again, that increases the risk. And does anyone intend to cut you or anyone you know? Now, for patients who are pregnant or mothers of daughters, you can ask, do you or anyone you know intend to have your daughters cut? A mother may be dead against it. Her mother or one of the elders in the community may say, you don't have a choice in the matter. She may have to go away, and suddenly the girls are cut in the mother's absence. So it's not enough just to get the information from the mother or the father that they don't want it done.